I'm Dr. Sho, for those of you who don't know me. Um, the full name breaks down as Dr. Itunu Johnson-Sogbetun. It is a mouthful. But so everyone just calls me Dr. Sho because that's easier. And who am I? I'm a UK-based portfolio GP. It says over 10 years, but actually next year will be 15 years of experience as a doctor in the NHS and private care. So it's been a little while now. And I'm a women's health specialist as well as a menopause specialist. So I'm a British Menopause Society registered menopause specialist, but I do other things as well. I'm to health equity, so ensuring that Black and brown women have the best optimal health care. And so, of course, it's important that every woman, but often Black and brown women have been left out of the conversation. And so it's really important to me. So I'm a passionate advocate for health equity. I'm also a wife, I'm also a mother. So I've also been a patient. So some of these experiences I've had myself. So I'm talking on the I'm a human being as someone who's also been a patient. Okay, so why is this important? So it's because intimate health is a really key part of overall well-being, but it's something that we don't talk about. The pelvic or sexual issues. Some people feel embarrassed, but there's absolutely no need to be. Some people find it like, oh, I don't want to talk about it because of stigma. But, issues here are common and also they're treatable. And that's why we're going to be talking about it today. Today is about empowering you with knowledge and solutions. Okay, so let's start with the story. I like stories. So this is Tolu. Tolu is 42. She's a busy mom of 3, and she noticed that she started having pain during sex, and she's feeling drier than usual. She's also lost interest in sex, and when she coughs, she notices that she laughs or she sneezes. Oh, there's a little accident, and she's having to wear these liners. And so, she's noticed that as well, and it's causing her concern. She's like, I'm really young. But maybe it's because I've had, children, my pelvic floor is not what it used to be, but she hadn't really thought about it. She just kind of kept quiet. But eventually she spoke to a doctor. She was given a cream to, vaginal moisturizer. Say, okay, just try that. But she wasn't sure what else could be done. And so she was just kind of suffering in silence. Okay, so this is quite a common story. Some of you might find that you've had experienced some of these symptoms. So, question, and this is something for you to kind of reflect on. If you want to put something in the chat, you can. Have you ever put up with a symptom, whether that's heavy periods or painful periods or feeling, not that everything's not quite right down there? Have you just thought, it's just being part of being a woman, or felt like I don't know who to speak to or how to talk about it? Have you ever done that? Because this is something that, many of us do. I mean, a few years back, I had some bleeding in between my periods. And even though I'm a doctor, I know you must get it checked out. It took me almost 6 months to go and get it checked out. And that was really naughty because it actually turned out that it was pre-endometrial cancer. So when I'm saying that, I've actually done it myself. I thought, oh, it's not going to be anything, it's fine, but it was. And thankfully they were able to give me the treatment and everything. But have you done that? And then the other question is that, I want you to think about and write in the chat if you've got some thoughts or you feel comfortable to share is, what would be the hardest part to talk about? Is it the pain having sex? Or is it the leaking, the incontinence? Or would it be the lack of sexual appetite? Would you feel, "Ah, should I be telling someone that I'm not as interested in sex as I used to be?" Would you feel maybe that's not something I should be thinking of as a problem? So if you feel like you could share your thoughts, please put it in the chat. I'm going to just have a look in the chat and see if anyone's put up, sorry, some people's put up thoughts. Okay, let's see. So I was drier and loss of libido. It took me over a year and I was not asking for help. The hardest part would be to talk about sex. Thank you so much for being open and honest. The leaking would be hard to talk about. Absolutely. Thank you. Thank you so much for being open and honest. How would it feel to know that there are real treatments that can help with all of these issues? And so it's really important to ask for help, because all of these issues, whether it's the pain, the leaking, or the lack of libido or lack of desire, all of these issues are treatable. Right. So the silence around sexual health. We know that many women endure these symptoms due to societal pressures and misconceptions. There's taboo, like, oh, a woman shouldn't express her own sexual desire. It's not very ladylike. We have shaming words that we use to call women who are open about their sexuality. We think talking about sex is something that should be a secret, right? And sometimes it has to do with religious beliefs as well. In some people might think that their faith means that because they're a person of certain religious backgrounds, they feel like, oh, it's guilty about women wanting sexual pleasure, and they don't want to talk about it from that perspective. And then there's the fear of judgment. There's so many myths about purity or good woman, quote unquote, whatever that means, a behavior that prevent open discussion and seeking help. But we need to be breaking these taboos, because it is not wrong, it is not bad, it is not, there's no shame in wanting to have a good sex life. It's a really important part of who we are as human beings. Our sexual health is important, but also things around our pelvic floor. These are very, very important. Now, we are just going to have a think around intimate health as it evolves through a woman's life and the different challenges. So we have puberty. This kind of hits from around sort of 8 to 10 years old. Many young girls will start their periods between 10 and 15. And in that situation, the periods are happening, the body is changing. That starts the curiosity around sexuality and sex. And you know what? As parents, because I know many of the people in this room might be aunts, might be mothers, might be grandmothers even, might be sisters. We should be talking about this in a positive way, naming our organs, talk about, call the names what they are. You know, let them talk about their vulva, let them know about their vagina, tell them about their periods so they're not being taught by strangers about sex. Let them not go and learn from the internet or from classmates who might be poorly informed, or God forbid, from predators about sex. Let us be the ones to tell them that these things are positive, to tell them how to approach it, to tell them about safe sex, how to protect themselves, from, you know, all of the awful things that can happen to a woman, so that they are in control of their own bodies and they make choices. So let's not pretend and run away and shy away from these conversations. Let's teach them about their bodies. Then, of course, you go into early adulthood. Women will have their first sexual experience. Hopefully, it's a positive one, but we know that many people have a negative first sexual experience. That can be for a whole lot of reasons. Some, you know, it's traumatic, some it's violent, some it's even abuse. But some, have a great experience, and each person's story is different. But whatever your story is, you can work on it to ensure that you have a positive approach to sex. And sometimes that might include having to go through therapy. But each person has their first sexual experience. You learn about these, you learn about how your body feels good, what feels good to you. You start to understand how to navigate your periods, feel more comfortable with your hormonal changes, all of those things. And then, of course, if you decide to get pregnant, there's a change, isn't there? There's a dramatic change. I remember after having my baby, postpartum, and it was when I first understood vaginal dryness whilst I was breastfeeding. I wasn't expecting it. And I was like, oh my gosh, I had a glimpse into what perimenopausal women have. And they don't often talk to you about that. But after pregnancy, you might find your pelvic floor is weak. During pregnancy, you might even find that when you're carrying the baby, you're having to run to the toilet. You might even have accidents. I actually remember that as well whilst I was carrying. I remember one time, I was in my sort of third trimester, I felt like nauseous and I didn't get to the toilet on time, and this was at work, and I vomited, and at the same time, because of the pressure of vomiting, I wet myself in the middle of the corridor in front of patients. It was so embarrassing, but literally that's what can happen with pregnancy, and your body changes. But we have to embrace this. We were like, oh, you have to embrace it. But the thing is, something can be done pregnancy to tighten those pelvic floors and to improve the outcomes so that you don't have ongoing problems after childbirth, because we do know that that baby puts pressure on the pelvic floor. And then, of course, we go into perimenopause, menopause, and postmenopause. And because of the hormonal changes, you might find lower desire, vaginal dryness, that dryness that you might have noticed in the pregnancy and the postpartum, which also, actually, interestingly, some people might notice they're a little bit drier in the second half or during the normal cycle, and that can again be as a result of the hormonal changes as the cycle goes on. But you might notice it more potently in the perimenopause and the postmenopause, and you might get lower desire, lower libido, and pain with intercourse, and that can impact intimacy without treatment. And there is no age at which you stop having you this. I have patients who are having sex in their 80s, even early 90s. There's no reason to say, oh, I'm too old now. There's no such thing. If you want to have sex, if you enjoy it, you should be having sex for as long as you want. And of course, we also want women to be able to feel comfortable in their own bodies. We don't want you to be struggling with urinary problems, and there's treatment for that as well. So you shouldn't feel, oh, I'm old now, I can just bear this. Okay, so why does sexual dysfunction happen? So different health conditions can make it more difficult. So if you have underlying conditions like endometriosis, fibroids, adenomyosis, it can cause pain. So conditions like diabetes can cause issues with the vulva and the vagina and can make it a bit more difficult. You can get current rash, those sorts of things, and it can make it more difficult. But of course, hormonal changes as well with, as I said, postpartum, you get the hormonal changes, that's after having a baby. Also during the perimenopause, menopause, low estrogen or low testosterone can affect desire. and comfort, because if you've got estrogen, helps the vaginal walls stay nice and moisturized and nice and lush. When estrogen is depleted, the vaginal and the vulval skin gets dry, and that makes it more difficult. And of course, if you're on certain medications like antidepressants, we know that they can lower libido, and so it can be a side effect of this. But also, let's remember, stress, trauma, overwhelm, mental load, tiredness, worry about your body image, but also, if you are having relationship problems and don't feel comfortable about being able to express yourself, all of this can make intimacy difficult. Now, there are treatments, there are solutions, and we're going to break it down into hormonal and non-hormonal solutions. So firstly, if you can, and you're having vaginal dryness, particularly in perimenopause, menopause and postmenopause, vaginal estrogen is fantastic, both for vaginal dryness, but also for urinary problems. So of course, pelvic floor is really important. The vaginal estrogen can help with the urinary tract that is also depleted of estrogen, to help manage some of those urinary issues, what we call the genitourinary syndrome of the menopause, that can make incontinence and urinary frequency and urinary tract infections worse during the menopause and beyond, after the menopause. You've also got vaginal rings. So you can actually have a ring you change regularly that can put estrogen into the vagina. We've got hormone replacement therapy, which again can be for the whole body if you're having generalized perimenopausal symptoms, and you can add in testosterone for a boost of your libido. There are non-hormonal solutions, so there's vaginal moisturizers, lubricants. I cannot overstate lubricants. Like, lubricants are so important. You know what? Even if you are just feeling a little bit dry, even if you are not that, you're just not getting sort of, just try a lubricant. Like, lubricants, if you're feeling like your sexual experience is not as good as it can be, add in a lubricant. It can really make things so much better. Like, and there's so many great ones now. There are ones that are particularly formulated for menopausal ladies. So a really good brand is Yes, 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 which is sort of aptly named. And then there's an Uber Lube, which is another great brand. That's a silicone-based one. Yes, 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 Yes. Do a water base. They do an oil base, and you know what? You can even use coconut oil. Like, feel free. You can use coconut oil for a lubricant, but the only thing is you can't use oil with condoms. So if you're using a condom, you have to stick with water-based or silicone-based. I highly recommend. Very, very, very good. And of course, pain medications or anti-inflammatories can be helpful as well. But again, there's so many things. Pessaries might be helpful if you've got a prolapse and that's what's causing the issue. But then there's things that you can do for self-management. And I really wanted to talk about this. And I'm sure that both our panelists are going to talk to you about this as well. So there's vibratory massage, and you can actually get a medical grade vibrator, and you can use to boost blood flow, arousal, and orgasm responsiveness. And it's so fantastic. And you could use a normal vibrator as well. So, but if you feel like, I want to get a medical grade one, feel free. But they're the same thing, more or less. And they're really good. You can try them yourself, work it, use it with a partner, you work it, really try and see if you can get that blood flow going to help with any sexual dysfunction that you may be having. Pelvic wands. This is my new favorite thing. I discovered it when I went for the menopause conference in America last year, with the Menopause Society, the North American Menopause Society. And boy, like, literally, I've recommended it to so many patients, and they've been like, Dr. Sho, Thank you. So this particular pelvic wand is the one that I recommend is made by a brand called Intimate Rose. And they have different ones. They have ones, so you can see that one end is quite small and the other end is quite big, but it's got a loop. So if, you can actually kind of manipulate it in ways that, you can use it to really explore just gently. And then when you get a bit more confident, you can use the other side. You use it with lubricant, and then they actually, so some of they have different functionalities, so they have different types. So one of them is just a plain one, but they also have one with temperature. So for some people that's really helpful, and they also have one with the vibratory built in as well. So again, you can explore. Then they're dilators, you can get that as well. So if you're really struggling, and you can learn how you can, again, very gently, different sizes of dilators. You can explore yourself with a small one with lots and lots of lubricant to try, and you can do it with yourself or with the partner. And then of course, mindfulness and breathing exercises and all of these things, you can help yourself, or you can do it whilst you're working with the women's health physio, which is obviously most ideal. But for some people who don't have access to women's health physio quickly, because, like, say, for example, here in the UK, it can be almost a year wait on the NHS for a women's health physio. These are some things that you can start off with. Now, holistic support is so important because this is all biopsychosocial. So yes, pelvic floor physiotherapy, uh, pelvic floor exercises. We've already talked about the dilators, vibratory stimulation, but also what you're putting in your body, your stress management, sleeping well, self-care, movement. All of these things are really, really important. And of course, there's the psychological and emotional. We've talked, some people actually have a lot of trauma around sex because they've had awful experiences or not very positive experiences or even violent experiences. So sometimes you need therapy. Sometimes the couple needs counseling and a relationship support. And sometimes it's about going to support groups to normalize experiences and have these conversations. Now, mental load, if you've been following me, this is something that I always talk about. A mental load is the visible thinking and planning that we as women still disproportionately carry for society. It's all of that load, and it's so much. And even with more, it gets so much heavier. And then we have things like social media, the 24-hour news cycle, and it's so overwhelming. And this can cause stress and exhaustion. And of course, this can lower desire and affect intimacy. So we have to be mindful that it impacts as well. And so what can you do? Honor your capacity. Don't push beyond what feels manageable. And you know what? Take your time, extend yourself grace. Sex is supposed to be pleasurable. Don't put that pressure on yourself. Give yourself grace and time. Just communicate with your partner about what's going on. You know what? Right now, it's too much for me. You know what? Maybe you can do these strategies, eliminate, remove what's not important, and that means prioritization. What don't I need to carry? What don't I need to carry? And I talk about rubber balls and glass balls. So rubber balls are things that if you drop, you can bounce back, and it can bounce back, and you can sort that out in, maybe come back to it in a few years or, in a few months. But glass balls are things that if they drop, they shatter. And that's things like your health, your relationship with your partner, your children, all of those things, your relationship with your family, all of those things are so important. And so effectively, you need to figure out what's important for you, and what is important for you different from what's important for me, and try and get rid of what's not essential. And then delegate, get help, from partners, from your local community. This is why we do life together. Sisterhood is so important. It's so useful to have women that you do life with, that you can share the load with. All of you can support each other. And if you can afford it, get help. So like cleaner or help with the kids, an after school nanny or things like that, if you can afford it, or get help from grandma, from aunties, your sister or your cousins that can help. All of these things are really important, and streamline your processes by facilitating. I often talk about how I get everything delivered, so I don't have to waste a brain cell thinking about, is there toilet roll, or is there kitchen towel, or is there toothpaste? It just gets delivered at regular intervals. That's part of how I manage my mental load. So what are the key takeaways now into the conversation? Pelvic sexual issues are common, but not something to suffer in silence. And effective treatments are present. Let's seek early help. Early intervention can prevent bigger problems later. Every woman deserves comfort, confidence, and pleasure in her body. And let's speak up, which is the first step towards healing and thriving. Now, this is literally just a very quick, patter through these issues. There's so much that we need to get into the meat of the matter. This was just a very, very gentle walk through it. And so we're going to do that now. Now, just to know about me, I have a private clinic, and I'm able to see patients both in Nigeria, in Lagos, and in the UK. And we do all these services, health checks, women's health, sexual and reproductive health, menopause care, weight management, basically anything that, and all these issues we deal with as well. So here's how you can reach us. That's our UK numbers. We've also got our Nigerian numbers as well, which we'll put in the chat. So that's that. So we're now coming to talk to the panelists. Let me just check in the chat to see what's been going on. Oh, wow. Thank you. Absolutely. Wonderful. Thank you for sharing about teaching your children. It's so important. So Faith and Yeside, can you get your cameras on? And yeah, it's time for us to get into the panel chat. And for all of you that are here, which is wonderful, you can start thinking about your questions that you want to ask. And if you're asking if a vibrator is good, I'm saying yes, a vibrator is good. And it really helps stimulate blood flow. But we could get into that more. I'm so excited for this chat. I've been so excited all week. You ladies are amazing. Both of you inspire me. And I remember the first time I met you, Olayinka-Agbola, I was just blown away. You are just such an incredible woman. And we're going to learn so much from you today. And Faith as well. When I found out about the work that you do, I was so impressed to know that we have such a fantastic women's health physio working in Nigeria and able to do such fantastic work. So I'm going to get both of you to introduce yourselves, and we'll start with Faith. And then Olayinka-Agbola, it will be your turn, and then we will just jump into the conversation. Okay, so Faith, do you want to introduce yourself to the group?
All right, great. Thank you so much, Dr. Shogbetun. It's a pleasure being here. My name is Faith Duncan-Shotunde. I'm a pelvic floor physiotherapist here in Nigeria, and I run a telehealth physiotherapy. So I run virtual services 80% of the time. And basically what I do is to help women overcome painful sex and help them with pelvic floor problems using physiotherapy protocols. Dr. Shogbetun has talked about other medical tools and resources you can use, but I focus basically on how you can use physiotherapy to overcome pain with sex and pelvic floor problems, right? And of course, infusing the biopsychosocial approach, that's very, very key into what we do. I would also say that I have programs in that regard. So particularly for painful sex, I have Thrust Perfect, which you can access from anywhere in the world where you are. There's a self-paced part of it. And also for those who have issues with urine leakage, you can also access my services through the control over PISM. So I'm here and I'm delighted to share a bit of my knowledge on the topics we're discussing this evening.
Thank you so much. And now over to you, Olori-Koitos.
Good evening, everyone. My name is Yeside, Olayinka-Agbola. I run a platform called Olori-Koitos, so I get called Olori-Koitos quite often, which is fine. I am a sexual and reproductive health educator and therapist. So what I do is I provide accessible and progressive education for all age ranges on everything from your sexual health to puberty to periods and period equity. I work by empowering people to have more knowledge about them, their bodies, and thereby inspiring confidence and helping you make informed choices about your health. I also am the founder of Flovantage Collective, which is an initiative that is improving menstrual health equity across Nigeria for women and girls. And when it comes to your sexual health and your sexual well-being, I have a practice where I practice out of a hospital where I work with couples and individuals who might be experiencing any type of challenges or trying to just level up on their sexual experience and their sexual health. Also, I'm a speaker, and I also do a really fun thing, which is I speak at a lot of bridal showers and women's groups to kind of help demystify a lot of what we think about sex in a very safe and intimate spaces as well. So I'm really excited to be here to talk about, how our sexual health is intertwined. And I'm very excited to be here with Faith and Itunu to, just talk about how like sexual pelvic health and menopause, because it's really, really intertwined. And thank you for having me.
No, thank you so much. I'm so excited. So I'm going to start with you, Faith. So I think the first question I'm going to ask is around bladder leakage, right? Many women quietly deal with bladder leakage. It's almost like that secret problem, right? What's the link between this leakage, the incontinence, and the pelvic floor health? And what can we do to help, particularly with regards to physiotherapy?
Okay. Bladder leakage, most women or individuals just think that it's a normal part of being a woman or it's a part of aging, right? And we most times attribute it to the woman who has probably been pregnant, who has given birth, who is a grandma. But now we have younger girls who also have bladder leakage. We have, children, we have adolescents. And when you have a bladder leakage, it's a sign that your pelvic floor muscles are not functioning in three major ways. Either they are too strong, or they are weak, or they are unable to actually even coordinate the activity that you need it to do. So that's me saying that you might have a bit of strong muscles, because the pelvic floor muscles is not just one muscle, it's an array of muscles. So it's possible that a part of it is too tight or a part of it is too loose, and then you're unable to coordinate. I'd say my internet connection is unstable. Can you still hear me?
Yeah.
Yes,
Can
we
we
can.
hear me? Okay, beautiful. So it's possible that you are not just able to coordinate the function. When you say, I don't want to leak pee, you're unable to do that. Or you're saying, now I want to pee, but the pee is not even going to come out because there is poor coordination. And this could actually even get worse with laughing, when you cough, when you jump, when you run. And then physiotherapy has a lot it can do. So we try to restore the balance. Like I mentioned, it could be that it's both weakness or there is also too much of strength. So what we want to do with physiotherapy is to create a balance. We want to ensure that you have enough flexibility and you have enough strength as you need, not you having too much strength or you being too loose. And physiotherapy does that through, of course, there's going to be an initial assessment to know where you are at. Which of these three levels do you fall into? Are you falling into the weak pelvic floor muscle, or you're falling into the overactive pelvic floor muscle, or the uncoordinated pelvic floor muscles. And then we design tailored exercises for you, to retrain your body so that your body can now start to do what it was created to do and how you want it to function. When you say go, it goes. When you say sit down, it sits down. Yeah. So physiotherapy can help to do that.
Thank you so much. And of course, the pelvic floor is one aspect of incontinence. We have stress incontinence, but we also have urge incontinence. But even alongside stress incontinence, if you're wondering what urge incontinence is, that's when the bladder is overactive. And so it just wants to pass urine all the time. And that's when people feel like they're constantly going to the toilet. And that's a different type. And sometimes you have mixed. So you have a combination of stress and urge incontinence. And of course, sometimes this is complicated by other gynecological problems. So you could have fibroids, for example, that are pressing on your urinary tract. You could have endometriosis and endometriotic lesions on your urinary tract or around your bladder that is making things worse. You could have adenomyosis, and because of that, you have a really big uterus that's pressing on. Or you could have a prolapse. And some people might wonder, what is a prolapse? So this is when the walls of the vagina are really lax and then they start to fall. And this is something else that a pelvic floor physio can help with as well. Faith, do you want to talk a bit more about that?
You mean the pelvic organ prolapse?
Yeah.
Oh, yeah. So for pelvic organ prolapse, it also falls within the three ranges. It could be weakness, it could be looseness, it could be too much of strength, and it could also be that there's no coordination. Now, for physiotherapy, we are going to be looking at how to increase the support that your pelvic floor needs. Is it that you need the strength? Do you actually need to rule out other trigger factors? So obesity, you mentioned, yes, we want to rule that out. How are you breathing? We want to rule that out because your breath is also important in the care of pelvic organ prolapse. We also want to see what internal support can we give to you? What external support can we give to you? We're looking at your body wholesomely, like from the crown of your head to the sole of your feet. What are the other muscles in your body communicating? Because the body is, really flexible. The body is a whole parcel. So you cannot look away from whatever is happening in the neck or the face as to what's happening in the feet. If the feet is healthy, we want to believe that it's going to translate into a healthy pelvic floor support. So we're looking at all those other external factors. We are also looking at your lifestyle, your day-to-day activity. Are you how do you lift loads? How many hours do you spend sitting down at your office desk? How are you actually controlling the pressure? When you were pregnant, how did you support your body? If you probably had a grade 1 prolapse in your previous pregnancy, did you do a postpartum rehabilitation to restore your body to optimal pregnancy, which is another load on that body, right? So we're looking at all of your histories from day one you were giving birth to the point where you are at now with pelvic organ prolapse. And then we're looking at those things we can remove, we can adjust, we can add to, just to ensure that we're giving your body the optimal support that it needs. And you could also use support devices, like I said, internal support or external support while we are doing pelvic floor muscle training. And that's beyond Kegels. It's not just Kegels, because I know people just think, oh, Kegels is the solution, right?
Absolutely. And we know that sometimes women need pessaries and other devices that can be used to help support. And some of the things that we've talked about as well can help with those exercises. And there are external things that you can use, external devices that you can use to help with increasing that pelvic floor tone as needed. Because as you said, sometimes it's too strong. So that's why we need that expert advice to know what we're doing so that we're not just guessing. Right. So now I'm going to come to you, Olayinka-Agbola. And what I'm going to say is sexual pleasure is often left out of the conversation about women's health. Why do you think it matters? And how can women begin to prioritize it?
Thank you, Dr. Sho. Honestly, if you think about how we think of sex in our society, we usually leave it out, just like you said, but it's really a really important part of our overall well-being. It's not just about having babies and procreation. It's also about intimacy and, excuse me, connection, self-esteem, and even just stress relief. Like those are some of the functions of sex. And so when you prioritize sexual pleasure, you are really performing a form of self-care. And you touched a bit on that when you were speaking earlier. And it's recognizing really that you deserve to feel good in your own body. So this means, just exploring what brings you joy and advocating for your own needs. And it's very important for women.
That's so important. And I think that women need to be able to express their own needs, as you said. And studies show that women don't experience pleasure as much as men do during intimacy. What do you think are the factors that contribute to this so-called orgasm gap?
So for those who may not know, the orgasm gap is a phenomenon where it has been shown that women in heterosexual relationships are more likely to achieve orgasm during partnered sex than men. So essentially, what's happening is that there's a gap, right? If a man and a woman have sex 100 times, the man is more likely to have an orgasm, say about 95% of the time, and a woman would have an orgasm maybe 60 to 70% of the time. So there's that gap. And what are some of the factors that could contribute to this? If you think about it, the first thing is literally lack of clitoral stimulation. The clitoris is the one organ in the human body that was created by God for women's sexual pleasure alone. And research has shown that many women require clitoral stimulation, whether directly or indirectly, whether external or internal stimulation to reach orgasm. But if you think about our traditional way of intercourse, this is typically overlooked because typical intercourse prioritizes penetration of the vagina by the penis. And that's a very efficient route for men to reach an orgasm, but it's not the most efficient route for women. So if we're not providing clitoral stimulation, we're going to see an orgasm gap. Most women will need not just penetration, but stimulation of their clitoris and stimulation of other organs, maybe their nipples and other parts of their body, to be able to achieve orgasm. And a big part of this is really just a lack of education about female anatomy. So in a lot of the work I do when I work with individuals and with couples and even with groups, is we talk a lot about anatomy. When you're able to really understand female anatomy, you really be able to understand why, what the different parts of the pelvic floor, but also the genitals and why certain parts need more stimulation than others. And it's also a personal thing. Now, when we talk about that, again, the focus on penetration is really big. So we need to decenter penetration, right? Penetration is not the only way. I've had women come to me and say, yesterday, I know how to, when my partner, goes down on me, either by oral stimulation or by their hands or other things, I can achieve orgasm. But I want to get to have an orgasm the right way, which is penetration. And they think it's such a problem that they're not able to achieve orgasm through penetration. And so the first thing I try to teach them is that, and tell them is that you don't have to have an orgasm through penetration. An orgasm from oral sex is not less than an orgasm from penetration. But because our society has so centered penetration, all these social and cultural narratives really really put that penetration on such a pedestal and then ignores other forms of intimacy that actually might be more effective for women. And then, of course, there's the pressure to perform and to have an orgasm or, to just show that like you're doing it. And you find a lot of women who are now faking orgasms because a lot of men are putting a lot of stock in their partners having an orgasm, but your partner is not necessarily doing, or both of you, what you're doing together is not necessarily getting you to a place of orgasm, but you have this pressure to perform. And so you just fake an orgasm as opposed to going with your partner and exploring together that, oh, okay, this might not be working. So let's try some other form of intimacy. Let's try other forms of stimulation of the body to be able to get you to orgasm, which might not be the traditional penetration. And really, the idea of just running to, we think of foreplay as just this thing where we just kind of mark off the territory, a kiss here, a little hug here, and we go straight to penetration. I think a big thing, bridging that gap, closing that orgasm gap really makes taking a shift in the mindset from male pleasure, from penetration, into like finding pleasure for both the man and the woman.
Thank you so much. That's so fantastic. And I think a really good way of understanding what brings you pleasure is basically self-exploration as well.
Agreed.
And so, there's a lot of taboo around this. There's a lot of, someone just asked me again, Ma, did you say that we could use vibrator in the chat? And I was like, yes, because it's a really important part of exploring our sexual function. And so for a lot of people, they think, oh, there's, but actually there's a physical benefit, there's a clinical medical benefit from that sort of vibratory sexual exploration, as I've explained. So again, understanding what brings you pleasure can then help feed into what goes on with your partner. And you can, of course, do that together. You can learn to explore each other's bodies. If you feel that you want your partner present, you can do that together to understand what feels right for you as well. Of course, we don't want people doing things that feel, because each person's gonna feel this is what feels right for me. So of course, only do things that feel right or comfortable. But I think it's really important for us to open our minds and to try and break some of these cultural taboos that don't really have any sense, any real that don't have any real benefit for us as we explore our sexuality.
And Itunu, might I also add that for people who are not as comfortable with, for example, masturbation per se or touching themselves, you can also look at pain when you and your partner are being intimate together, when your partner is pleasuring you. Pay attention to like how your body responds to that. That is also a clue for you to be able to see how, what will work for you. Because to be honest with you, it's like I always say about sex. I say, we present to you a bouquet, like a buffet of, an array of things you can do during sex, but not everybody is going to choose everything. So while we say, yes, self-exploration is great, it's one of the best ways for you to really be able to understand what happens with your body. But if for any reason you're just not at that point, you're not able to cross that boundary, whether for personal reasons, for religious reasons, for cultural reasons, what you can really do is pay attention when you're with your partner, right? When you're being sexually intimate with your partner, if they touch you by the ear, if they touch this part of your body, you pay attention to how your body responds to that. Do you like, like rubbing more, or do you like a pinch more, or do you like a soft touch more? Do you like direct clitoral stimulation, or do you like it when they just kind of orbit around there? Is it is it direct touch? Is it a piercing touch? So those are the kind of things. So when you're paying attention to how your body is responding in that moment, and that really requires you being present and, focusing on the sensations. And that way you can then communicate to your partner that, oh, when you do this, my body really responds better to this. And can we explore more of this than maybe when you do this, this doesn't really do anything, or I don't really like it when maybe you have a partner that blows in your ear, for example, and you're like, it actually distracts me. Perhaps we don't do that and we focus more on this.
I love that, because there is no judgment. Whatever feels comfortable for you. If that doesn't feel comfortable for you, then each person, this is all about your own pleasure, and so there really is no judgment here. So thank you so much. That's so fantastic. So I'm going to come back to you, Faye, and we're going to talk about what advice you give to women who feel embarrassed to talk about pelvic floor problems, and also what daily habits can women add to better protect their pelvic health.
Okay. The first question is such a common undiscussed question, right? Like a lot of women feel embarrassed. I mean, you already talked about your own experience, how it took you about 6 months before you went to have the bleeding checked, So women need to first understand that this is a common problem. You're not alone in this. I mean, it's as good as pelvic health problems is as common as malaria in Nigeria. It's as common as, oh, someone has a headache. So it's not something you should be shy about. I know it's an intimate part of our bodies, but if you can actually, see a doctor because you have a boil in your armpit, then you should be able to see a healthcare practitioner if you have any challenge around your pelvic health. The pelvic floor area is just it's for you, right? It's personally yours. But when it comes to your healthcare, you need to feel free to open up to your healthcare practitioner. I mean, studies have shown that nearly 1 in 3 women will face some form of pelvic floor challenge because they even have a higher impact on their pelvic floor, based on the fact that you have to get pregnant, you have to push through for baby, for vaginal delivery. And then women are also known to do a lot all at once together. And if you don't understand the mechanism of work in the body, how your imbalanced shoulder or the weight of your buttock or the fact that you have low tone muscles in your back can actually affect how much of strength your pelvic floor can give to you, then you will just be doing life with all that you're doing, having a baby, carrying a baby, doing your office work, doing home chores, helping around without actually paying attention to your body. You're at a higher risk, of having pelvic floor problems. And I want you to know that pelvic floor problems is like every other health problem. And you shouldn't feel embarrassed talking about it. You should be able to ask for help. In fact, it's the foundation that is carrying your whole body's weight. And the common Christian parlance is if the foundation is destroyed, what can the righteous do, right? So if your pelvic floor has a poor foundation, if the foundation of your body is weak, what then can you do to the strength of the whole body? And I say again that this even goes as far as how your feet looks, how your knee looks. So if you're having knee problems, for instance, you have osteoarthritis of the knees, or you have knocked knees, or you have the bone knee, you most likely are going to be having problems in your pelvic floor, right? So please don't feel embarrassed for any reason to ask for help when it comes to your pelvic floor. It's as important as every other part of your body. If you're going to go to a doctor to fix your eye problem, then when you have a pelvic floor problem, please seek attention early, because even early intervention would help you to mitigate further issues down the line. And then the other question you said, what habits can women actually do to better protect their pelvic health? Mindful breathing is something you can add. Because when you do mindful breathing, you're able to actually tone down tension and stress in your body. When you do mindful breathing, you're able to massage the organs in your abdomen. They move up and down, they're not getting stuck. So you're not putting all pressure on the pelvic floor muscle 24 hours a day. You want to be intentional about your hours of being on one spot, or your hours of standing for long, your hours of sitting for long. You want to do exercises that are friendly to your pelvic floor muscle. But then before you do that, you need to also know the state of your pelvic floor muscle. So I would ask every woman, have you actually done a pelvic floor assessment ever in your life as a woman? You go for eye check, you go for your BP check. Pelvic floor assessment should be a vital assessment for you as a woman. And then you need to stop wearing tight clothing. Let me add that, because that's a common thing with our women, especially here in Nigeria. We want to do the corset clothing. We want to wear, because we want to look also trim in our clothing when we go on outings. You're wearing the belly binders, and then it gives you that figure of 8. It's as good as you're squeezing and squishing yourself from the middle. When you do that, like I said earlier, your body is fluid, your body is flexible. So you're squishing from the middle, and you're applying pressure down on your pelvic floor muscle, and that's going to cause more problems. So you want to stop the tightening of the abdominal muscles. If you're going to the gym to run your exercises, please seek professional advice on how to actually use your belt. Using the corset belt is helpful, but there's a thin line between you inflicting injury on your body and the corset belt actually giving you support and help.
Thank you so much. That's so great. I feel like there's something that we haven't spoken about, and I'm just going to bring this to both of you because I think both of you are going to have different lenses on this, and this is about painful sex, right? So I know we've talked about pleasure, but for a lot of women, sex is painful. And this problem, you know, has so many different facets to it. So what I wanted us to kind of talk about is if there's a woman in our audience who struggles with painful sex, what can she do? So I'm going to start with you, Olayinka-Agbola. David, please, can you unmute Olayinka-Agbola?
Great. So I think for women who experience painful sex, I mean, in talking to our audience now, we know that quite a number of women that might be experiencing, you know, the child maybe perimenopause or menopause or even after menopause. There's something called dyspareunia, which is when you start experiencing painful sex. And one of the reasons why this could occur could be because of vaginal dryness. It could be because of vaginal thinning. You know, we know that estrogen helps to keep the vagina, you know, moist and thick, and this helps a lot in during sexual penetration. But if the vagina starts to feel dry and thin, then it can start to feel like sandpaper, and that can lead to like micro tears during intercourse, and that leads to a lot of painful sex. And then of course there's, you know, sometimes a loss of elasticity. But even for younger women, it's not only for women experiencing menopause, but even for younger women, you can experience dryness, and this dryness could be from being not as lubricated, and usually the first culprit after you've done like a hormonal profile to be sure that it's not a hormonal reason why you're dry. It could also be lack of being dehydrated. So the biggest thing that I always talk about, I am what you would call a lubricant evangelist. Use lubricant. The simplest, like, please, I want you to, you know, go to, you know, Dr. Faith and get, you know, a pelvic examination done and, you know, learn how to work on that. But I'm going to tell you that for me, from my end, lubricants. What are lubricants? They're should I say liquids that help with reducing friction. We have water-based lubricants, we have oil-based lubricants, we have silicone-based lubricants. Pick your choice. They're recommended because what they do is they reduce friction. And when you reduce friction, you actually even, another good advantage of it is it increases, you know, pleasure, because now you're no longer dry. I mean, even if imagine that I'm rubbing my hands together, it starts getting hot. Before you know it, my skin is going to have micro tears, and it's going to feel like they're pouring pepper on my skin as, you know, the motion continues. So please don't suffer in silence. Use lubricant. And then, but also, on the same lane, you have what we call the vaginal moisturizers. They're slightly different from lubricants because with lubricants, you put the lubricant on the penis and you also put a little bit in the vagina or on the vulva area, and I always say just a little bit in the vagina as well. But with vaginal moisturizers, they're meant to not be used just at the point where you want to have sex, like lubricants. But vaginal moisturizers, you use them quite regularly, every couple of days, depending on how often you need it. But what it does is it helps to like hydrate and restore moisture to the vaginal tissues over time. So think about it like your face, you know, you might have like dryness in your face. So imagine that you have dryness in your vagina, and this can help you to improve your vaginal moisture over time and hydrate it over time. There are a bunch of other things as well, but I know that Dr. Sho will talk about it from the medical angle, and Dr. Faith will talk about it from the pelvic floor physio angle. So yes.
Love that. A lubricant evangelist. I'll join you in that evangelism. Um, but I think it's really important to also understand that, for a lot of women who are sort of perimenopausal and menopausal, vaginal estrogen is also really, really important and really, really useful. But painful sex can happen for a lot of reasons. So we've talked about, the dryness perspective, but there are other conditions that cause painful sex. So things like vaginismus, that makes it women struggle to have penetration. And we know that there can be physical reasons for that, but there can also be psychological reasons for that. So I'm going to come to you, Faith, and talk about, painful sex from that lens, for when women struggle with penetration, with vaginismus, from that perspective, and other issues that can make sex painful. From your perspective, what can women do?
Okay, so for people who are experiencing vaginismus, difficulty with penetration, one thing I would advise you to do first is stop forcing through the pain. Pain is a signal, it's a symptom that what you're doing is not right. So stop forcing through the pain. Don't keep believing what people say that, oh, that's the life of a woman. Sex is going to always be painful on the first attempt. No, it doesn't have to. It shouldn't. It's not even that it doesn't have to. It should not be painful on the first attempt. And that's you being educated for that. It shouldn't be painful on the first attempt. What other thing can you do? Spend time in a less tensional area, less tensional space. You want to take off everything that increases tension in your body. That is stress, loud environment, being in an atmosphere where there's no love. That little things that we ignore so much. For some people, they might not even be shouting on you, but the fact that you're in a space where you cannot voice out your opinion, you're in a space where you find it difficult to laugh, you find it difficult to express joy, you find it difficult to communicate easily. You don't want to be spending lots of hours of your life in that environment. One thing that should be a resolving solution to painful sex, or sorry, difficulty with penetration, particularly vaginismus, is that we want to relax your overall body muscle, not just your pelvic floor muscle, because we could decide to work on your pelvic floor muscle and other muscles in your body are screaming. So there's going to be a ripple effect. So you might feel that you have penetration today, which may still be a little bit painful. Then you realize that some days after you try to attempt penetration again, it's difficult, it's more painful, or it's even more difficult than the previous time you attempted it. That's because it wasn't the whole body that was treated. It was because we're just focusing on, oh, let's see how we want to go in to the vaginal canal, and you're forcing through. So get out of any tensional environment that you're in. If you're not in a tensional environment, maybe you grew up in one, maybe you've had long-term conditions in your body that caused pain. And that could be just shoulder pain that's been there for so long. I keep emphasizing that the body works as a unit. So if you've had constant pain in your body for so long, you are sending signal down to your pelvic floor muscle to also be tensional. It's also be in a state of, oh, I'm not sure if I'm safe to open up. So there's going to be a lot of closure down there. So you want to seek medical attention for any chronic pain that you're managing in your body, very important. You want to avoid environments that are not friendly, environments where you're not happy. You want to spend more time in spaces where you feel comfortable in your body, and don't ever force through pain. Penetration pain should not be, oh, let's use a bulldozer to crush it and so that we can get in. You may get in forcefully, but there are going to be bruises. And it doesn't guarantee that the next attempt is going to be an easy peasy one. In fact, most of the clients I work with would say that the next attempt is much more difficult than the previous one because they had to force through pain. If you actually follow through the few things I've mentioned, you just see that your body starts to understand that you personally, you love it. Your pelvic floor muscles start to identify you as a friend and not an enemy, and starts to identify things around you that want to actually go into the vagina as a friend and not an enemy. And this is even beyond having a penis having to penetrate the vagina. So because some people will think that when we're talking about vaginismus and we're talking about solutions to vaginismus, it's only particularly to have intimacy, it's only to have sexual pleasure with your partner. It affects a whole lot of other things. If you're not married and you need to go for a pelvic floor examination, you want to do a cervical screening, for instance, it's going to be difficult and painful for the speculum to go do some stuff as the vulva, into your vagina. There's going to be a whole lot of tension for you because already you know, oh, this is not something that is easy for you. So you're tense up, your doctor cannot access, or then they have to. For some people, penetration still cannot happen. So take advantage of the few things that I mentioned while you also seek professional help, because it's not a one thing fix all. We have to look at you holistically and then provide the best solution for you.
Thank you. And I think there's often a psychological element as well. Olayinka, do you want to give your view on that?
Well,
and also just generally about how mental health and mental well-being affects sexual and intimate health.
Well, piggybacking on what Faith had talked about, if you know what she said, you don't want to bulldoze through the pain. If you bulldoze through the pain, it becomes like this self-fulfilling prophecy where mentally you are expecting pain, and once you expect that pain, you are already anticipating the pain. Your body has tensed up, so the next time, whenever penetration is going to occur, or before you even get to penetration, any form of sexual intimacy is occurring, physical intimacy, your body is already tensing up to expect pain. And then you experience pain and you're like, yes, I knew this pain was coming. And so look what's happening now. And then you tense up more, and then it just becomes, again, it's this self-fulfilling prophecy. And then it just puts you in this very terrible cycle of pain and anticipation and just not in a good mental space. But really, when we talk about our intimate health, our mental health and our mental well-being is really, really connected, because our minds and our bodies are not separate entities. Whatever you're feeling in your mind will reflect in your bodies. You've heard of women that lose their hair when they are experiencing a lot of stress. When you're experiencing stress, anxiety, depression, low self-esteem, any form of shift in your mental well-being, all these things can negatively impact your sexual health. We've talked about the physical symptoms like tension that can cause you to not be able to relax or to be able to enjoy intimacy. But then just generally, you will feel like a decreased libido, because when you're stressed, your body is just not prioritizing sex. Your body is in fight or flight mode, and sex has come down the chain of command, really. When we're thinking about if you're having issues with like your body image, as we experience different life changes, our bodies start to change. And if we start to if you don't have a good image of your body, if you have poor body image issues, for example, you're self-conscious about your body, because of whatever reason, you might be in like a postpartum stage, or it could be because you've gained weight or you've lost some weight, or you're just not feeling confident about your body. When you're not as confident about your body, you are more reluctant to share that body with a partner or with someone else. And then it makes it difficult for you to be vulnerable about your body. But also mentally, I believe Faith talked about it when she said that if you're not in a safe space, if you're not in a relationship that is a safe space for you, it's very difficult for you to be physically vulnerable, or for you to, you know, if you're in a relationship where you can't really speak your mind, there's a lot of tension, there's a lot of stress, it makes it difficult to really for you to be able to express your sexuality at, you know, an optimal space. And of course, that also leads to things like, you know, there's communication breakdown. If you can't discuss with your partner, or you are experiencing mental stress, or you are even having any mental health struggles, it makes it difficult to communicate with your partner about what you're feeling or what you want. And, you know, then you now start having misunderstandings, and then there's frustration, and it's just this cycle. So a big part of it is really, for us as women, I always, my new thing now is telling women, I tell you to prioritize yourself, and I tell you to decenter men. And I know that this is, you know, there's society tells us, you know, oh, you know, you want to be in a partnered relationship, you want to be married, you want to be with a man, and all that stuff. But when I say decenter men, I'm not saying that men are not important, but I'm saying that by decentering men, center yourself. You as an individual are important. Your needs are important. You know, find out what gives you joy. Focus on the things, like a lot of us were not raised, especially as women in our societies that we live in, and this is across the world. As women, we're not taught to prioritize what brings us joy. If you speak to most men, you know, they are number one on their timesheet. They are number one. They're going to prioritize themselves. But we as women, you know, from a young age, they're telling you, they're prepping you to be a wife, prepping you to be a mother, prepping you to be, you're always thought about in your relationship to somebody else. Like, imagine most women, when they put their epitaph, they say wife, mother, sister, daughter. A lot of times when they talk about men, you know what they're talking about? They're talking about their achievements in life. Let that be yours. What are the things that you want to be known for? What are the things that bring you joy? Focus on that. And that would really help in terms of helping your mental health, prioritizing yourself, prioritizing what brings you joy. And that really it's a massive step towards just having a healthier, more fulfilling life that would then lead to a more fulfilling sex life.
Love that. Self-care is not selfish.
No,
And I
it's
think,
not.
as you said, we've been
Right.
programmed. You know, I think we've had a conversation about this, whether it's nature or nurture, that makes us self-neglect as women. And it's almost like it's a self-neglect instinct that women have to be like, you know what, I'm going to put myself last all the time. And I'm not saying be selfish, but put yourself, prioritize yourself. You are important. You matter. And I think that's a really good place for us to start asking from the audience if you've got questions. We've got about 9 minutes because I want to let you go at 9 o'clock. So if you've got any burning questions, so that we can finish the main program at 9 o'clock. I'll still be on for a few more minutes if anybody wants to stay behind, but I want us to finish the main program at 9 o'clock. If you've got any questions, you want to kind of put it in the chat or raise your hand. I see that there have been some questions in the chat. Someone's asked, does cesarean births offer better outcomes? The answer to that is mixed. Because you still carry the weight of a baby, even if you have a cesarean, you can still have problems with your pelvic floor, but it's probably not as damaging to the pelvic floor as vaginal birth, particularly the vaginal birth doesn't go well. But you can still have a traumatic cesarean section. So it's a bit of a mixture. It's a bit of a mixture. There's sort of pros and cons to both procedures, but you can certainly still have problems with your pelvic floor if you've had a cesarean. How can the bladder, urethra, and the cervix be restored to their normal functioning after radiation? So that's, you know, really thank you for asking that question. Such a difficult thing to treat. And, you know, especially, you know, if depending on what the because so some of the time that's treatment that can happen for cervical or uterine cancers or other you know, bladder cancers and rectal cancers. It's tricky because it depends on what kind of damage. But again, all these things that we've talked about, pelvic floor, vaginal moisturizers, lubrication, if possible, vaginal estrogen, if you can have it, depending on what the cancer was and if it's something that would be activated by hormone. But again, all of these treatments can help make things more comfortable and more beneficial for you. This is more of a kind of specialist area. It's worth seeing a specialist to get that level of further intervention, but certainly there's stuff that can be done to help you. So someone else has asked the question, how does contraception impact libido and fertility? And should we choose it or rely on natural family planning, even though it's less effective? So most contraceptions do not have a negative impact on libido. And I mean, I'm a big fan of contraception because for me, when we look at the history of medical progression, alongside penicillin, vaccines. So when I talk about penicillin, I mean antibiotics in general, vaccines and contraception stand out in the last century as things that have made human life better, particularly for us as women. It's because of contraception that we've been able to take our place in the workplace. We're still fighting for our place anyway, but at least even give us that platform. And so contraception is very, very useful to help. Of course, I know not everyone can have it and not everyone wants it, but for those who are trying to do family planning, it's far more effective than natural family planning. And there's no reason to want to avoid contraception because of worries around libido. But I'm aware that sometimes women have side effects, but we can always find the right one for you. I'm going to come to you today because I can see her shaking her head.
No, I just thank you. I just wanted to add that I think this question might also come from a place of not wanting to use hormonal methods. And I want to say that there are non-hormonal forms of birth control or contraception. For example, you can have a copper IUD, which a lot of women opt for, especially if you want long-term contraception. You can also use condoms. A lot of people in long-term partnered relationships and marriages feel like condoms are something that non-married people use, but married couples also utilize condoms as a form of contraception if they don't want any hormonal method. So there are other ways. The natural contraception way is tricky because if you are not someone who has a very regular period, and meaning that your period comes on certain days every day in this cycle at every month, and they're not, and sometimes hormonal life stress, different things could also affect that. So you want to be really careful with the natural, which is like counting your safe days and your not safe days. But there are other methods, the IUD, the condoms, and those are the top of my head. So if you're not interested in using hormonal contraceptives, those are some methods you can use as well.
Yeah, absolutely, because it's all about your choice. So I mean, I know that I'm an advocate for hormonal treatments as well as non-hormonal. I'm an advocate for all of it, but I always, when people don't want hormonal treatment, I always want to find out why. Right? Because there's so many myths and misconceptions around hormonal treatment. And actually, we have so many options now, and there's ongoing research. There's so many natural estrogens and progesterones available. There's so many natural methods of contraception that match the same hormones as our body produces. Actually, the fears of many of the older types of contraception you don't have to be there anymore because we have so many newer options. So that's where I'm coming at, because I do realize that some people have had bad experiences on hormones, and I'm not trying, but what I'm saying is have an open mind, ask questions, see someone who knows, so you can have all the options, hormonal, non-hormonal, they're all there for you. Someone said, oh, just a comment about women having had their clitoris cut off. And yeah, that's so awful. FGM, thankfully, it's been banned in many countries now, but that really caused so much problem for women and their pleasure when, they had that unfortunate experience. Now, does anyone have any final questions before we get our panelists to give their last thoughts before we close? Okay, so I'm just going to hand over to, oh, okay, someone, Olaoluwa Oni. So, please, can she be unmuted? Oh, I'm the one to unmute. Sorry.
Okay, good evening. Thank you so much for this program. It's been a wonderful time, though I joined very late because the link wasn't sent to me when I registered on Tuesday. Maybe I was late. I didn't know. I don't know what happened, but I'm very grateful. Please, I would love to have the recordings, really. I appreciate what you've gone through. I appreciate so much. And I would like to stay behind to maybe a recap or summary. I really look forward to that. Thank you.
Okay, thank you so much. Right, so closing thoughts. So we start with you, Faith, and then we'll go to Olayinka-Agbola.
Okay, so I'll just like to say that for every woman here, the most important thing you need to know is that, or one of the important things you need to know is pelvic health is not luxury. Pelvic health is as important as every other aspect of your health. So for some people, they might find that pelvic health costs a little bit more. It might cost a little bit more because we have few health practitioners in that line. And yes, they pay a whole lot through their nose to get their education. But don't think that it's another part of your body that you need to ignore, because it's the foundation of you as the woman. That is where that's the part of your body that houses your major organs that makes you unique as a woman. You have your womb there. What makes you really function? You have you don't want to pee on yourself, you don't want to poo on yourself. So you have your bladder in there, you have your rectum in there. You shouldn't ignore it. Sexual health is important to you overall. It has its impact on your overall body health. It has its impact on your ability to be a fertile woman or not. So if there is anything that seems to be not to be so clear that you are feeling, you're seeing signs, you're having symptoms, as little as painful menstruation, irregular menstruation, don't wait for too long. If you have a girl child and they're experiencing these symptoms now, don't wait for too long before you start to seek help, because you could actually nip it in the bud. Your pelvic health paves the way for your overall confidence. If you're peeing on yourself or you're pooing on yourself, you don't want to go to a workspace and people are like, oh, you're smelling. I started a conversation with someone yesterday and she was giving me a scenario of a lady at her workspace who actually couldn't hold her pee because the person who had the key to the toilet in the office was not available on time. So before the key came, she had already peed on herself. And she kept emphasizing, that was so embarrassing. That was so disgraceful. And then I told her it wasn't her fault. If she could, she would have held back the urine. Unfortunately, her body failed her at that spot. And I'm sure she must have been seeing signs and symptoms before that very day. But because she felt it's something intimate, nobody knows, nobody's going to know, or why should I spend money on pelvic health care? She probably didn't seek help until that accident happened. And I'm sure for a very long time, she's never going to forget what she experienced at the workspace. Because the way this lady was talking about it, she was, so embarrassing, so embarrassing. I can never, she was going to say, God forbid, it can never be me. I said, it can be you if you don't get help at the right time. If you're having symptoms and you don't get it fixed, it can be you, it can be anybody. So please get help at the right time. Pelvic health is not luxury. It helps your confidence and it helps you to live a good, high quality of life. And stop suffering in silence. Yes. Stop suffering
Thank
in
you so
silence.
much, Faith. Someone's asked in the chat, how can we get in touch with you? So please put your details in the chat so that people can know how to get in touch with you. Thank you so much, everyone, for coming today. It's been incredible to have you with us. We've only been able to scratch the surface and tinkle on this topic. It's a huge, massive topic. As I said, I'll stay behind afterwards to answer any questions for people. So I see some people have asked some questions about menopause. So I'll be here to answer a few questions for at least another sort of 15, 20 minutes. But thank you again to everyone. I really would have loved for Olayinka to give her final thoughts, but it seems like she's frozen. Yeah, thank you for everyone for joining. The recording will be sent to you. If you have any questions, as I say, you can stay behind and ask, or you can email. Our details of how you can get in touch with us are on the system. And yeah, thank you so much. It was so lovely to have you here. Olaoluwa, you have your hand up. I know you made a comment. I thought that was it, but maybe you have another question. And if anybody else has questions, you can raise your hand as well. So I will unmute you.
Thank you very much. Actually, it was the old hand, but I'm
Oh,
looking
it
forward
was
to hearing briefly about the menopausal
perimenopause. Okay, so it's
symptoms
really
as well.
So firstly, I have a book on on menopause in Black women, which covers everything from perimenopause, menopause, postmenopause care. It's a basic book. My team will put it the link on how you can get it in the chat. But very, very basically, perimenopause is that period from when you are having your normal cycle to when you have menopause, which is 12 months when you haven't had a period, for 12 months. And the symptoms of perimenopause and menopause are so varied. They say there's over 75 symptoms, but the most common ones are hot flushes, night sweats, what we refer to as the vasomotor symptoms, brain fog and memory loss. So women will struggle with word finding difficulties, mood symptoms. So that's mood swings, anxiety, low mood. Those are very, very common symptoms as well. Sleep disruption. So women struggling to sleep because of the menopause. So finding that their sleep is not as good. And then also we talked about the genitourinary syndrome of the menopause, and that includes vaginal dryness, urinary symptoms, painful sex. All of those symptoms are together called the genitourinary syndrome of the menopause. So as I say, there's other things like dry skin, women get thinner hair, all sorts of things, low libido, you know, some women feel itchy, joint aches and pains, fatigue. There's so many symptoms that women get with the perimenopause and the menopause. And of course, you know, the treatment is always biopsychosocial. So obviously we want to think about lifestyle, which is the pillars of everything. So that's what you're eating, what you're putting into your mind and into your body, movement. We also want to talk about physical activity, nature, spending time in nature, having good social networks, mental load management. And of course, for those who want it, there's hormonal treatments and of course, non-hormonal treatments. I know the mainstay of hormonal treatment is hormone replacement therapy. So I can see someone called Mercy has got your hand up. I'm going to just unmute you to ask your question.
Yeah, good evening, everyone.
Good
Thank you
evening.
to the facilitators. It's been really, really educative. And I want to say, well done, guys. Please, I'd just like to ask a question concerning the pelvic floor. If there are some, exercises that can be suggested to help ladies. Thank you very much.
Great. I'll hand over to Faith.
Okay, so it depends on what your concerns are. Basically, we have flexibility exercise. We have exercises that actually reduce tension in your pelvic floor. We have exercises that make them stronger. We have exercises that helps to teach you how to coordinate the actions of your pelvic floor. So I won't be able to actually just tell you do a particular flexibility exercise or a strengthening exercise if I don't know what your specific needs are. There are different exercises for different conditions. We can't just give an umbrella exercise to this. I know the popular thing that people know is the Kegels exercise. And I've mentioned that Kegels is not for everyone. It's not for every condition. For some people, it may just be your posture that we need to change. That is a physiotherapy, a pelvic health physiotherapy intervention. So it's not always about the exercise. It's about what intervention do you particularly need to actually solve the problem that you're facing.
Yeah, perfect. Thank you so much for that.
Okay.
That was so great. I think in the UK there's an app called Squeezy, right? Because we all if you can go and see a pelvic floor physio, that's the best thing. And if you can get onto one of Faith's programs, that would be absolutely fantastic if you're having problems with your pelvic floor. But for some people who can't access, there is an app called Squeezy app, which has been created by physios, women's health physios here in the UK. So Squeezy, Squeezy, and it's a free app, and you can get some support with pelvic floor exercises. Now, of course, there's the traditional Kegel exercises, but as Faith has mentioned, sometimes you're not doing it properly, or you don't know what your needs are. So again, the best thing to do is to get specialist input, even if it's just 1 or 2 sessions, to even just get an idea of what you need, so that you can then go on and do the work yourself. It's really important to try and know what you're doing. Similarly, if you're having problems with the genitourinary syndrome of the menopause, it's worth coming to see a specialist, because then we can really advise. Or if you're having sexual relationship problems or sexual health problems, someone like Olayinka-Agbola would be really such a good person to speak to, especially with the partner. She can give you specific advice. So again, self-help is great, but if you can actually access that specialist opinion, it can really take it one step up. So let me just see, any more questions? Anyone else want to ask questions?
Someone says, what is the intervention for prolapse? Do you want me to go ahead?
You can go ahead.
Yeah. So prolapse is also a broad treatment spectrum, right? But one of the basics that you can do is to actually give your body some support. It can be an internal support, which is the pessary. Dr. Shogbetun mentioned earlier. It could be an internal support, but even with that, you need to see a professional to help you assess you for what particular pessary you're going to need and help you actually fit them in. There's also the external perineal support. So there's this product, My Pelvic Bra, which you just wear like a panty over your regular panty, and it helps to give a lift, upwards on your perineum, so you don't actually feel, you're actually supporting your pelvic floor, and then that pressure is taken off. If you would want to invest in any of this, you can actually communicate with me. Also, you also want to consider your posture, your lifting techniques. But all of these are just what I call them, little fixes here and there. It's not going to give you the full treatment protocol. We need to check how other parts of your body are supporting your pelvic floor. And why is it that you have a pelvic organ prolapse? What triggered your own prolapse? And how can we prevent it from progressing further? There are 4 different levels of pelvic organ prolapse. Some people are already on stage 1 and they don't even know that they're on stage 1, but they're having symptoms like low back pain. They're having symptoms like a bit of heaviness or pain below their abdomen. For some of them, they just pick a mirror, look into their vagina, and then they see a pink flesh. Or they just see that there's a blockage. You can't even see through the vaginal hole. There are different degrees to prolapse, and there are different treatment regimen per the varying degrees. But if you just want an umbrella-like solution, just takes the weight off, yes, you can try the internal support, which are the pessaries, or you can try the external support, like the My Pelvic Bra. Yeah, it's a support for the pelvic floor.
Thank you so much. So it's now 1:15. I'm just mindful that you guys have to go. So before you go, Olayinka-Agbola, do you have anything you want to add?
Thank you so much for this, I guess, opportunity to speak to these great women. I just want to add that, you know, your sexual health and your sexual well-being is not something that you have to leave behind. It's not a different part of you. It's a very integral part of who you are at every age and at every stage of your life. So what I would like to leave you with is for you to kind of reframe and view whatever stage you are of your life and look for opportunities for one to reclaim your pleasure, which is discovering what brings you joy, not just in the bedroom, but outside of the bedroom, and exploring them, and then strengthen your relationship with yourself and also relationships with your partner. Because if your body is experiencing any changes or any, you know, we've talked a lot about perimenopause and menopause, your body experiences a lot of changes in this time. And these changes, you will need to have a lot of open communication with yourself and then being able to share that with your partner so that you can foster like better intimacy and connection, but then also advocate for yourself. We've talked a lot about, you know, pain and discomfort, and you don't have to accept it as your normal. You have a right to pleasurable and a fulfilling sex life, and it's important for you to talk to professionals. I know that, you know, it's very easy for you to self-medicate. You go on Google and you just go and type in, oh, I feel this and I'm feeling this, what can I do? But also don't be afraid. You know, you have experts for a reason. We're experts for a reason. Speak to experts so that you will be able to get solutions that are tailored to you. A lot of the things you find online, not because they're not good. I mean, we all have online platforms and we speak a lot, but we speak in general terms, you know, so we will not be able to give you may not be able to find a solution that is tailored to you until you're able to come and give us, you know, backgrounds. We ask questions, we kind of delve deeper into your history and what is going on with you so that we're able to give you something that works for you. So instead of you running about for the next 5 years trying to find a solution from all these different angles, why don't you have 1 or 2 sessions with an expert that can actually help you put you on the right path, and then you can go your way into doing that. And I want to just leave you with you understanding that you should embrace your confidence. You're a woman, you're strong, you're beautiful, but you're also soft and vulnerable. And I think that this dichotomy is what makes us really special. And there's a real power to you. Own that power, own your sexuality, and have that confidence that only comes with yourself. And as we get older, this is something that even gets better and, you know, sweeter even with age. And so I would like to leave you with that and to help you understand that, you know, you're important and your sexual health is important as well.
Amazing. Thank you. So I'm going to let you go now. So thank you so much. Honestly, ladies, you're fantastic. Yeah, thank you to everyone. If there's no more questions, let me just check to see if there's any more questions in the chat. Oh, 11 new. Oh, oh, okay. So I'm going to let you guys go. I can see someone has asked a question about painful periods. I'll answer that, but you guys can go. And yeah, it's been lovely to see you. Thank you so much.
Good night. Thank you.
Good night. Good night.
Bye.
Okay, so someone's asked the question about what causes a painful period.
Night, everyone.
Good night. Good night, Faye. Thank you so much. So somebody has asked a question about what causes a painful period and what can be done to alleviate it without relying on painkillers monthly. So with painful periods, there's 2 main types. There's primary, which means you've always had painful periods, and that's generally mediated by or caused by prostaglandins, which are these inflammatory hormones that are in our womb and uterus that are activated when we're having our monthly period. And so that's why we recommend anti-inflammatories, because anti-inflammatories help counteract those inflammatory prostaglandin mediators. And then there is secondary dysmenorrhea, which is secondary painful periods, which means you didn't have painful periods before, but you've now developed painful periods, and usually that's caused by a medical condition. And of course, any painful periods needs treatment, because we don't want anyone suffering, whether it's primary or secondary. But secondary, usually there's an underlying cause. So it could be endometriosis, it could be fibroids, it could be adenomyosis, it could be PCOS, it could be endometrial polyps, it could be infection, it could be a whole range of issues, which is why if you are having painful periods, you need to go and see a specialist to unpack why, and then to have investigation. So usually we'll start with an examination, we would do swabs, we would order a scan to see why you're having those painful periods, particularly for secondary painful periods. That means the one that you didn't have it before, and then now you have it, or you've had it and now it's so much worse. Whichever one, that needs to be checked out. And in terms of treatment, there's so many different treatment options. It depends on the cause. And so, the treatments will be divided into sort of medical, which could be hormonal or non-hormonal, and then surgical treatments as well. So let me see. Okay, any more questions? Any more questions? Okay. Olaoluwa?
Okay, once again, thank you very much. I really appreciate this. I would love to ask, I know there's this word, dodging, that I heard is not right to do. But,
Douching,
sorry?
Yes, douching, yes.
All right, douching, yeah. So a friend of mine actually mentioned something about this Oriflame intimate wash, and I struggled with it. I don't know. What do you think?
So effectively, we would strongly advise against douching, or in fact putting anything into the vagina. The vagina is self-cleaning, and whenever you put anything in, whether it be douching or putting any vaginal cleansers or whatever, you are disrupting the natural flora, which is the natural bacteria that live in the vagina, which keeps it healthy. So when you start disrupting that, it can lead to all sorts of things like infection, pain, discomfort. So pain, like infections like bacterial vaginosis, thrush, these are some of the things that are caused by this douching. So please stay clear of douching. You can wash the vulva with just some water, or you can use an emollient. So most of these advertised vaginal washes are not helpful, because most of the time they contain fragrances, they contain chemicals that are harmful to the vulval skin. So just water or an emollient, which is like eczema cream, to wash and moisturize the vulva. Don't put anything into your vagina, and really don't waste your money on these cleansers, because they actually cause more problems. Okay, ladies, this has been fantastic. It was so great to spend time with you all. If you want a personal opinion, get in touch with the clinic. We're very happy to support you. Have a great